Hi, my name is Dr. Rodgir Cohen. I'm here to talk about the role of occupational licensure in creating poverty problems within the United States and California. Occupational licensure is a process by which a government defines qualifications in individuals and what they must possess in order to practice a profession or a trade. This situation means practitioners cannot legally practice their occupation or run a business without meeting these qualifications. Those who practice their jobs without becoming licensed would pay a fine or even face jail time. And that's how our current systems work within many professions in California. It takes an average of 827 days to obtain an occupational license in California at an average cost of $486. And you might be saying, well, Professor Rodgir, of course, I don't want my doctor to be unlicensed and an occupational license for my doctor. Well, we're not here just to talk about medical professions. We're talking about the disparity and differences between occupational license need all the way from hairdressers all the way up. So the rates of the state's poor by race are as follows. Latinos are 22%, African Americans are 18%, Asian Pacific Islanders are 15%, multiracial groups are 14%, and white constitute 12% of those in poverty. According to the Archbridge Institute, occupational licensing increases inequality according to the Gini coefficient by 12.77% in California, while reducing upward mobility by 5.53%. What that means is the poorer you are, the harder it is for you to have upward mobility in your work and in your income production, and it creates inequality with people. The proponents of occupational licensing claim that licensing procedures are intended to safeguard the public health and safety by introducing mandatory education requirements and industry oversight. It is also expected that licensing will support the career development of licensed practitioners through the raising of quality of professions so that people become more qualified. But who is protected? The complex nature of the market transactions might not justify the abolition of all occupational licensing for most people. Of course not. You don't want to get rid of your licensing. You need to become a dentist. When it comes to licensing, the first professions that come to mind for consumers are only those of higher education: lawyer, dentist, physician, etc. A bachelor's degree is already required to practice these professions and also going on to advanced graduate work. However, the United States restricts licensing requirements and they're demanded for a variety of other occupations. So occupational licensing has been increasing every year for decades, with the highest share of this increase is against those who require less formal education, generate lower or medium incomes, and those are the people being targeted for more licensing and regulation by the state. As of 2015, the Council of State Governments estimated that 1,100 professions were licensed, certified, and registered across the country. And the number of licensed occupations in the United States increased from less than 5% in the 50s to over 25% of professions are now regulated by the government in the United States. And when the government gets involved and regulates, it does stymie the economic output of our economy. Occupational licensure in California, 1 in 6 employees has some sort of license in California. And research shows that workers are not leaving their factories or farms to move into previously licensed occupations, and many previously unlicensed occupations are now becoming licensed. So most of these occupations affected are specific to lower income groups. The most striking problem with California's occupational licensing is the burdensome requirements placed on contractor jobs. The licensing of 34 contractor businesses poses a significant obstacle to the entrepreneurship of the lower income earners within the state. The burden of occupational licensing for mobile home installers, tree trimmers, midwives, animal trainers, pest control applicators, veterinary technicians, psychiatric technicians, cosmetologists, shampooers, makeup artists, skincare specialists, and manicurists is above the United States average here in California. Occupational licensures is one of the most important factors trapping minorities and communities of color into poverty. Costly and time-consuming licensing requirements place a heavy burden on low-income communities, and having access to that education in order to become licensed is also very difficult in order for someone who is in a cycle of poverty and a person of color. So due to occupational licensing problems within the state of California, consumers may pay an additional $203 billion for their annual goods and services. One study by Kleiner, published in 2015, demonstrates that occupational licensing can cause 2.85 million job losses annually. And the employment growth rate is approximately 20% higher in states that do not require licensing. One of the most detrimental consequences of occupational licensure for low-income families is that it reduces the appetite for entrepreneurship. According to a study conducted in 2015, the rate of low-income entrepreneurship is less than 1% at 0.38%. That means there are only 380 entrepreneurs for every 100,000 low-income earners within the United States. A nationwide study conducted in 2017 on the relationship between red taping and 10 low-income occupations shows that the higher the red tape index score, that the more harm or hurt was done on those low-income occupations. It would decrease productivity and entrepreneurship greatly because of these red tape problems that are placed upon these lower income jobs and professions. So I leave you with these questions about occupational licensing. Will the male labor market improve, or does it hinder access into a job profession market and keep people from being qualified faster into the employment? Does it allow for mobility in California for us to be able to go between jobs if licensure is so difficult to attain and so costly for people to change jobs? And does it help the economy or hurt it? I leave you with these questions because in order for California to have more entry-level jobs, we have to provide a pathway for people that's greater than just prohibitions. We have to be able to provide solutions, either decrease the amount of entry-level requirements or provide some sort of mechanism or pathway for people to become licensed in these jobs that doesn't involve them taking a substantial financial burden or harm on their families, because it's impossible for people to make a transition change unless we are adequately making it possible for them. I look forward to our next time together. And until then, I'm Professor Rodgir, and we're still talking about problems in public policy in California.